Why do we need bioactive dental cements? There's so many cements available to us today for all the different techniques and substrates. Today, let's learn why we need bioactive dental cements, especially ACTIVA bioactive dental cement. Recently, Dr. Gordon Christensen in Dental Economics penned an article, "Why Do Crowns Come Off?" He went on to explain the difference between luting versus bonding our crowns, and that luting works by having an intermediate material that fills a space, the undercuts, like zinc phosphate did for so many years. Bonding, he says, implies an adhesive agent is used or included in the cement. Bonding to dentin has been unpredictable and product dependent, according to Dr. Christensen. Clinical observations do not support long-term retention of many products claiming to bond to dentin, and often these products debond during surface. So what happens when these bonds degrade? We must come to the point where we realize that bonding is not the issue or the reason for failure of crowns, it's micro-leakage. Crowns, bridges, inlays, onlays, and veneers can be failing before they ever fall off. And the hopes of ACTIVA bioactive cement is that it will seal the margins on an ongoing basis and prevent micro-leakage. So our focus is on the margins of the crowns. Marginal failure is the primary cause for crown failure and more. Cements can be quite soluble and wash out. Adhesives within the cements can degrade and cause micro-leakage of bacteria. The continual pH changes will affect the cements and the surrounding tooth structure as well. Biofilm formation at the gaps seep into the gaps, breaking down the tooth structure. And of course, there's always poor patient compliance. Secondary caries at the crown margins, shown by the black arrow, caused by accumulation of biofilm in the crevice between the crown and the tooth structure. These crevices occur because of the washing out or the constant pH change of the cement. This is where bioactive cements have a strong suit because they will form apatite to continually seal these margins. You see with the white arrows that hyperplastic gingiva has increased due to plaque accumulation around the fixed partial denture. And so bioactive materials can help the tissue stay healthy and solid to the tooth. A recent published article showed without a doubt that only calcium-based or bioactive cements can actually seal these gaps. And within maybe 7 to 13 days, these gaps can be filled and sealed continually by the apatite formation of the calcium and the phosphates. ACTIVA bioactive cement demonstrates excellent dental tubule integration and forming resin tags. In addition, the bioactive component of ACTIVA, the HA, and other chemicals indicate an adequate potential to provide protection in the oral environment. This study will be presented in 2016. ACTIVA bioactive cement continually seals, bonds, and protects the margins. It's filling these margins with calcium and phosphate apatite. These apatites will help prevent marginal leakage. These ions are continually released to the surrounding tooth structure. Surrounding soft and hard tissues respond naturally to ACTIVA and aid in the healing process. Bonding occurs chemically with the phosphate and calcium ions to all substrates used in dentistry. The flexibility of ACTIVA bioactive cement is incredible. It can be used for zirconia crowns and bridges, lithium disilicate, resin ceramic crowns, porcelain fused to metal, all CAD/CAM products, stainless steel crowns, implant crowns, and post-cementation. Because of Pulpdent's reputation of being a research company, more than 25 studies have been performed. All the physical properties, the compressive, tensile, and toughness and flexural strengths have been tested. Bacteria and micro-leakage testing, crown pull testing, and shear bond testing have been done. Solubility and acid resistance, ion release and recharge of the calcium, phosphate, and fluoride, and of course apatite formation with and without a bonding agent. So we invite you into the wonderful world of bioactive cements, and especially ACTIVA bioactive cement. means better long-term outcomes for you and your patients. Thank you very much.